Hi, I'm talking about Medicare Supplement Insurance. One of the best guides the government has ever put out is the Medicare and You Guide. They will send this to every Medicare beneficiary, 70,000 people in America every year. You need one of these, and this is something you need to become intimately acquainted with. It's actually easy to read, well written, and you will learn a lot. I can't say that about many government documents. So you can call 1-800-MEDICARE to order it. You can go to medicare.gov to order it online, or you can do what I do every year, ask my parents or my neighbors to give me their copy. Now, in this guide, it's going to break down Medicare. And then it'll give you other resources, other websites that you can link to. The thing that most consumers look at is at the very back. And the very back is going to show you every Medicare Advantage plan available in your state, every Part D drug plan available in your state. What it does not show you is every Medicare supplement plan available in your state. Why not? As most people would agree, that government is biased towards Medicare Advantage. Why would the government favor Med Advantage over Medicare Supplement? It saves them money. Medicare Supplement is the premier program for your clients. It supplements original Medicare, and it gives wraparound coverage that basically you'll pay your monthly premium and your deductible. Now, there are many plans of Medicare supplements. The beauty of that is they are standardized. So the government says if you have a Plan G with Aetna, it will be identical in benefits to a Plan G with Cigna. Okay? Every plan is identical by law. So then it comes down to a cost comparison. That's where your clients think they don't need you because anybody can see this price is cheaper than this price, and there couldn't be anything further from the truth. It's not the entry-level price that matters with the Medicare supplement. It's the projected price increase that matters. When you buy a Medicare supplement, for the very first time, you're coming in guaranteed issue, which means they have to take you regardless of your health. You're already in a hospital, getting chemotherapy, they still have to take you, and they can't ask you about your health. That happens basically once in your life, and that's when you first become eligible for Medicare. So they're vying for 11,000 people that turn 65 every day. They're vying for that entry-level client to come in, and they don't know if they're healthy or they're sick, so they just need the law of large numbers to help them. They need a lot of people because some of those people are going to be in the hospital on chemotherapy right now. The majority of people coming in at 65 tend to be rather healthy, especially compared to the demographic of the rest of the people on Medicare. So what do? They put a loss leader price out there. They're going to give you the milk very, very, very cheaply to get you in the grocery store and hoping you'll buy the bread, which they've inflated. That's the same with Medicare Supplement. They give you a very low introductory level rate because you bought it when you didn't have to qualify. Now, the rate will go up every year with a Medicare Supplement. Whatever Medicare Supplement you buy, almost invariably, there are a few exceptions, will go up each and every year. They cannot go up based on your individual claims history. They have to go up based on their whole block. But they typically go up at least 5 to 10% a year because of medical inflation and the experience on that book. So your clients say, well, they're all going to go up. I think I'll start with the cheapest one. Well, they all do go up, but some go up very, very slowly, and some go up like a rocket. That's where you, the advisor, comes in. You're able to help them see much more than they can see with a simple price comparison. That's why we've picked the best, most stable Medicare supplement products for you to represent. There's always new ones coming out. There's new ones coming out every single day. That's because it's a huge growing market. People want to make money, but they want to make money and get out. They don't want to make money over the long haul. So they come in with a really low price and they keep raising it like a rocket. Your client is then married to that plan because the only way you can move once you're on a Medicare supplement plan is if you can requalify. So you can move at any time. And that's also a misconception because people see all the ads, radio, TV, their mailbox is full of flyers between October and December every year. And the message they're getting is, hey, it's that time of the year where you can switch your drug plan. You can switch your Medicare Advantage plan. It's the only time of the year you can do it. You better act fast. So the whole population now has gotten that message, but they've misinterpreted it. They also think that applies to Medicare supplements. They think they could only change Medicare supplement plans during that annual election period. It's not true. You can change your Medicare supplement plan anytime. You could change it every day of the week. The only catch is you have to be able to answer those health questions. And there's about 100 health questions. Basically, do you have anything wrong with you? Or have you been in the hospital in the last 2 years overnight? Or have you been diagnosed with something that's yet to be treated? Do you have anything big wrong with you? Okay? So if you do, you cannot change Medicare supplement programs, and you're essentially married to the plan you bought at 65. So therefore, they might have a captive audience. If you bought the cheapest one that was out there, they know you can't move, and they can inflict any amount of damage on you with your price increases because you can't move. So you don't want to just look at the cheapest price. That's where we help you talk about the performance, historical performance of this carrier, which of course we cannot project the future performance. There's many things at play, but it is something very, very big that you'll take into account when you determine which plan to recommend to your clients or to your family. So a Medicare supplement, I said, is a Cadillac program. It is a Cadillac program because you don't get nickel and dimed every time you use it. Nickel and dimed, as in copays, coinsurance, deductibles. That is the world of Medicare Advantage. Medicare Advantage is very, very attractive on paper because of its low to no premium. So for a typical Med Advantage client in your area, there would be a plan most likely that costs $0 per month. No monthly premium. There are even plans that will give you money back if you purchase it. It's called the Part B give back. So you might purchase this plan and get $70 reduction off your monthly Part B premiums. You can see how people can quickly gravitate towards that plan. Without knowing anything about it, that's very interesting. Versus a Medicare supplement in your area, which will vary across the country, but between $100 and $200 a month for somebody turning 65 for a Plan G. So 0 to negative 70 versus $100 to $200 a month. Plus over here on the Medicare supplement side, you'd buy an additional plan, you'd buy your drug plan to pair them together, which would be another $10 to $50, where your Medicare Advantage would have it included. Okay, stay with me. Nickel and diming on the Medicare Advantage side means every time you go to a doctor, see a specialist, get therapy, every single thing you do is going to cost you. $20 to see a doctor, $40 to see a specialist, $50 for therapy, $100 for the ER, $130 for the ambulance, on and on and on and on and on. Versus your Cadillac, the Medicare Supplement Plan G, all you pay is your monthly premium and your deductible. Now, you say, what about Medicare Part B? You have to sign up and pay for Medicare Part B. That is true, and that's across both platforms. You must have Part B to have a Medicare Advantage or to have a Medicare Supplement, so that's a fixed cost, so I'm removing that from my equation. But if you're helping somebody figure out exactly how much they're going to be charged a month for their insurance, you start off with their Part B, $130 something, more if they're a high earner, so that could go up to $400 and some a month. Then the supplemental insurance plan they want to buy. Like I said, a Medicare supplement, $100 to $200 a month. The drug plan that has to accompany it, $10 to $30, $50 a month. Or Med Advantage, which could have 0 monthly premium. But the thing that's hard to predict is going to be the out-of-pocket costs. The 10, 20, 50, 100, 20%, 50% deductibles that are here. That's why I said Medicare Supplement is considered the Cadillac, because you have a fixed amount that you can pay a year, and you know at the beginning of the year, this is the most I will pay. With a Med Advantage, you also have a fixed amount because they have a floor. Once you hit that, then you can't pay anymore, and that's typically around $5,000 to $7,000. Or if you go out of your network and you max out your plan, it's around $10,000. So it's not sky's the limit with risk on either side like original Medicare. However, your risk is much higher over here. Your reward is much greater because if you didn't go to the doctor all year, your actual insurance cost could be $0 if you bought a $0 plan. So greater risk, greater opportunity for reward. Most people like the stability and the security of a Medicare supplement because they know exactly what their costs are going to be every month. So that is the intro to Medicare supplements. And in the next video, I'm going to go a little deeper into Plan G.